Have you ever noticed little specks or strands that seem to drift across your field of vision? These are called eye floaters. They can look like tiny worms, cobwebs, or just blurry spots. Floaters are more noticeable when you look at a plain, bright background, like a clear sky or a white wall. Floaters aren't actually objects floating in front of your eyes. They exist inside your eye itself. The inside of your eye is filled with a gel-like substance called the vitreous humor. As we age, this gel can become more liquid, and tiny fibers within it can clump together. These clumps cast shadows on the retina, the light-sensitive layer at the back of your eye. We perceive these shadows as floaters. Floaters usually move along with your eye movements. They might seem to dart away when you try to focus on them. This is because when your eye moves, the vitreous humor and the floaters within it move as well. The floaters often seem to drift slightly beyond the point where your eye stops moving. The blue field entoptic phenomenon is another fascinating visual effect that you've probably experienced without realizing it. Look up at a bright, clear blue sky. Can you see tiny, bright dots moving rapidly across your vision? These dots are not stars or UFOs. They're actually white blood cells moving through the capillaries in your eyes. The capillaries are tiny blood vessels that supply oxygen to the retina. White blood cells, also known as leukocytes, are an essential part of your immune system. They travel through your bloodstream, patrolling for invaders like bacteria and viruses. When a white blood cell passes through a capillary in front of the retina, it momentarily blocks some of the light passing through. This creates a tiny, fleeting shadow that we perceive as a bright blue dot. Both eye floaters and the blue field phenomenon are examples of entoptic phenomena. This means they are visual effects that originate within the eye itself, rather than from external sources of light. These phenomena offer a glimpse into the normally hidden workings of our visual system. Floaters occur due to age-related changes in the vitreous humor, the gel-like substance that fills the eye. As we age, the vitreous humor can become more liquid and the microscopic fibers within it can clump together. These clumps cast shadows on the retina, which we perceive as floaters. The blue field phenomenon, on the other hand, is caused by the movement of white blood cells through the capillaries in front of the retina. These cells are slightly larger than the capillaries themselves, so when they squeeze through, they create a momentary gap in the blood flow. This gap allows more light to pass through, which we perceive as a bright blue dot. Most of the time, eye floaters and the blue field phenomenon are harmless and nothing to worry about. They are simply a normal part of how our eyes work. However, a sudden increase in the number of floaters, especially if accompanied by flashes of light or a loss of peripheral vision, can be a sign of a more serious condition, like retinal detachment. If you experience a sudden change in your vision, including a sudden increase in floaters, it's important to see an eye doctor immediately. Early detection and treatment of retinal problems is crucial for preserving your vision. Remember, your eyes are precious, so take care of them, and don't hesitate to seek professional help if you notice anything unusual.